I'm Melissa. I'm a nursing student. I'm going to give a IM injection today in the ventrogluteal of an adult. So I'm going to walk you through that process. First thing you need is your MAR. My patient is Charles Wong. So I'm going to read his MAR. It says that he needs a penicillin IM injection at this time, 11 o'clock for today, 2/26. He's going to need it weekly, but we're going to concern ourselves with right now. The reason for it is due to an infection, and he's going to need the dose of 2.4 million units. So first thing I'm going to do, and he doesn't have any allergies either. And all his information's up here, so I'll verify that with the patient when I go in his room. So the first check I'm going to do, besides reading my MAR, is I'm going to look for the drug in my med cart. So I'm going to open up the med cart. I'm going to wash my hands first. Then I'm going to open up the med cart. So I'm opening up the med cart, and I'm going to look for my penicillin. Right here, I have it's a benzathine penicillin, also known as Bacillin. So I want to make sure that I have all the names correct. So this is labeled as Bacillin. It does match up. This one, the expiration date is intact. I'm also going to check for the dosage. So this says I need 2.4 million units. This one comes in 2 million units per ml. So I'm going to convert that, which I did ahead of time with a partner, which comes to 1.2 milliliters I'll need to draw up. So I then want to make sure that's for the right route. This is an IM injection medication, so I can use this bottle. Everything seems good. So I'm going to take it out, close the drawer, and then going to, again, verify which patient I have, why he needs this, the dosages, make sure my calculations are correct. I'm then going to need to get my supplies for this. An IM injection, you need to have the right syringe to hold it, so I need 1.2 milliliters. The best one I have for that is a 3 milliliter syringe available to me right now. This will hold the amount I need, and the increments are appropriate. I'm going to draw it up. So, oops. Try to find a clear space on a med cart. First thing you're going to do is you're going to clean with alcohol swab the top of the vial. Okay. And then you're going to throw this in the trash. There's usually one on the side of your med cart. So then I'm going to open up the syringe. So this syringe, I'm just going to take the cap off, keep the needle facing away from you. I'm going to pull up the safety a little bit first, because first thing I want to do is I'm going to draw air into the tube in the syringe. So I'm going to pull the plunger back to the 1.2 mLs. That matches with my MAR. 1, 1 down, 1.2. Okay, so I'm going to pull the shield back. I'm going to inject air into the vial first. I'm then going to rotate. And now you're going to pull back on the plunger. Now, you should hold the plunger in, because the air will push back on the plunger and pull it up, which is what just happened to me. Some medications you can't pull back into, you can't push the medication back into, so you'd have to start again. I'm going to then hold this securely, and I'm going to pull the plunger back until I get to the 1.2. Now, I have an air bubble in there, so I'm going to pull the needle out. I'm going to pull the shield down, and then I'm going to just tap out the air bubble that it's appropriate and it's out so that way it doesn't harm your patients. So I'm then going to take this. Don't lock the shield because then you can't get it open. I'm going to put it down. I'm going to again double check everything while I go to put this away. So Bacillin, I can't speak. Bacillin, it matches the right drug. I got the right dose, the right units, mLs. I converted it to 1.2 milliliters needed, so the right dose is there. The right reason, I will verify as well when I go back in there, but he needs it for an infection, which matches up with the drugs used for. He needs it for this time, 11 o'clock, so the right time. Should be for Charles Wong, which I'll verify when I go to his room. The IM route, which is what this medication is for. And then I'm going to put the medication away into my med cart. And then I'm going to grab my MIR, my medication, and my supplies I need for the room. I'm going to have an alcohol swab, a cotton square to put pressure after the injection, and then you can put a piece of tape if someone wants to keep it there. Otherwise, you can just use a Band-Aid. And we're going to go check on the patient. Alright, so I'm going to go to my patient's room. I'm going to knock into the room. I'm going to pour my wipes, so I'm going to wash my hands first. Usually while you're washing your hands, you're going to introduce yourself. My name's Melissa. I'm going to be your student nurse today. Are you Mr. Charles Wong? You're going to verify with the patient verbally. While you're doing that, you can also do the second verifier, which is checking their bracelet. At the start of the video, my needle was on the table, but it wasn't out of my sight. You do not want to leave your med out of your sight once you have it drawn. It's to stay in front of you. So you can put it next to you as long as you can see it in front of you. So I'm going to quickly double check his information. I'm then going to go over and explain the procedure with him. Make sure that he knows he's getting a shot. I provide privacy beforehand. He has a single room, so I've got to verbalize that part. And then the safety aspect, which I will go over after I verify what we're doing. So, you know you have a shot today, the Bacillin for an infection you have, is that correct? Okay. Do you have any allergies to any medications? You know, any food allergies like corn? No? Okay, that's good. Do you have any other questions? Alright, so you're going to get this shot in the ventrogluteal. That's this area over here on the side of your bottom, on your hip. So I'll walk you through it if you'd like, and I'll show you where that is. So I've identified the patient. I made sure he knows what med he's getting. He has, you're going to get 1.2 milliliters of this medication. You're scheduled for it right now at 11. And it's going to be IM, which I explained the reason. So my MIR I'm okay with, so I'm going to put it down. And then I'm going to, if you don't mind, I'm going to look at the area to map out where I need to put the injection. I'd raise the bed to be at the appropriate level and height. The greater trochanter. You're going to put your palm on the greater trochanter. Now, his abdomen and pelvis is this way. So I want my thumb facing in that direction of the interior of the body, the front of the body. So I would find the greater trochanter, and I put the palm there. What I'm going to do with these fingers up here is I'm going to feel for the iliac crest, and I want to find the anterior and posterior sections, which are right about here. So my thumb will be there, and when I find where those ridges are, I'm just going to spread it out, and my shot's going to go right about here. So I mapped it out. What I'm going to do is roll this back, and I'll perform it again, but I just wanted to go through it first. So I'm going to put gloves on. So I'm going to put the needle on the bed. The safety cap is still on. This is going to help me keep it in front of me. I left it behind me to show me where to put the shot. So we're going to take the alcohol wipe, and we're going to mark our spot. So again, I'm going to put my hand on the greater trochanter, find the iliac crest. I'm going to spread my arms out. My thumb's going to be towards the pubis region. I want to make sure it's right about here. So I'm going to clean a little area. And then when you have the area cleaned, you can actually leave your alcohol wipe with a point to the area cleaned. Now, because this is a mannequin, I do not want to stab it, so I'm going to use a fake injection pad, which would be right here. So, it's sort of hard to hold this. I'm going to pretend I've got this spread out. I've already wiped it. My safety is on. Now, I'm going to pull the safety back. I'm going to hold it like a dart. I'm going to go in intently at a 90-degree angle. Now, I'm then going to switch my hands to hold it with my less dominant hand. I'm going to aspirate this because I want to make sure I'm in the muscle for this medication, which you don't do with vaccines, but you can do with this medication. So I want to pull back. I don't see any blood, which means I'm in a muscle. So then I'm going to inject it slowly. You might feel a little pinch. It's almost done. Okay. So then I'm going to pull the needle out. And when I pull it out, I'm going to point it down away from everyone. And I'm going to block the safety this time so that it can't come back off. While I would be doing that, I would also have the pad put pressure. Do not massage it. You just want to put a light pressure. And then I'm just going to put a Band-Aid that I make shift here just for comfort for the patient. I'm going to take the needle. I'm going to throw it away. Okay. Thank you very much. Not so difficult, right? Alright. So I'm going to make sure the patient's comfortable. I'm going to then converse with the patient, make sure that they understand what responses they should be seeing with the penicillin. I also want to let them know of any adverse reactions or effects that they may have, so that way if it happens they can inform me, or use the call bell, which I will leave with them before I leave the room. Is there any other questions that you have for me? Okay, so I'm going to leave with the call bell. I'm going to then lower the bed if I had risen it, and I'm going to wash my hands before I leave the room. I'm going to go document, and then I will come back in probably about 30 minutes to come check on him and make sure that he's not having any allergies to the medication that we weren't aware of or any adverse effects.